I'm Hemal Gada. I'm the president of the Heart and Vascular Institute and the medical director of the Structural Heart Program at UPMC Pinnacle. I'm also an interventional cardiologist. I do a lot of minimally invasive structural heart procedures. Those are procedures that affect the structure and function of the heart as they relate to the various valves within the heart and actually the chambers within the heart as well. We are involved in a variety of different clinical trials investigating novel therapies that decrease the invasiveness and limit the invasiveness of these previously very invasive surgical procedures. And so we're able to do these procedures and get patients out of the hospital the very next day, changing not only their longevity, but improving their quality of life in a very significant way. I think the most impressive thing in my career has been the rapidity at which we've been able to answer clinical questions that are relevant to our patient populations. So being able to start and finish clinical trials that are extremely important to help us define better therapies for patients that we can institute more rapidly than what was previously available. And so getting these minimally invasive valve procedures that I'm involved with up and going from basically the start in the early 2000s to where it is now, which is basically mainstay of therapy. That would not have been possible without groundbreaking clinical trials. Through the AHA and its efforts, clinical trials are available to our patients at UPMC Heart and Vascular Institute. And I'm really gratified by the fact that we have such a great agency really supporting clinical trial initiatives across the board, not just in my space, but in a variety of other spaces within the realm of cardiovascular disease. I think we have to make sure that access to care is not jeopardized by something like the COVID-19 pandemic. I think that we've obviously invested a lot of time and resources to providing support to our telehealth structures, and I think that that's something that needs to be further vetted. But in addition to that, we do a lot of virtual observations and proctoring of the procedures that we do at UPMC Heart and Vascular Institute. That's something that I think has been essential to help other physicians learn some of the techniques, some of the things that we do uniquely here. And I think that an emphasis on information technology is absolutely required moving forward, and making sure that we all stay connected no matter what our physical restrictions are. I think it's important to remember that even with COVID-19 going on, that you still have very significant health issues that matter. Clearly, we show up to work day in and day out to help patients with their underlying non-COVID related medical issues. Of course, we're doing this in the safest possible way, making sure that we have the best-in-class hygienic apparatus set up for our patients to feel safe and comfortable. I think the American Heart Association does a very good job at democratizing care, and so making sure that everyone is able to receive the same quality of care, or as close to the same quality of care as everyone else in the country. And I think that the American Heart Association has made that a primary mission by supporting not just its community outreach initiatives, but the fact that it is a very big benefactor to clinical trial development. And so having that focus has been something that has advanced the care in this country and has created a level playing field for everyone in this country to receive the same quality of care.